Are unexpected, so today we have to just wrap up a little bit early. But you know, if coloring really connects with your inner child, then that is a great coping strategy. There are other great coping strategies. Earlier we saw dancing and singing. So you do what you enjoy in order to lower the stress levels is the point of this activity. So I hope everybody was able to put their emotions on paper. And yeah, my next activity was going to be around discussing our issues with each other and being able to debrief with each other. So I'm just going to encourage you instead, talk to each other. Give each other supports around coping strategies. Offer each other suggestions, okay? As a community, we can also support each other and help each other support our mental health, okay? So thank you very much, and I will pass it on to George.
Thank you very much. So we've got some emergency as well. If you've been watching on social media or the media itself, we've been hit by an announcement by the Ontario Science Centre with regards to, I think, closure of the property to the public. And because of that, it is actually affecting our programming as well. This was not expected. It was also expected by management of the property. However, in a discussion with the management, they have allowed us to continue with the conference today and tomorrow. And because, thank you. And because of the emergency situation that came up like that, we must be able to go now again and re-communicate and reassure most of the colleagues and folks that were prepared to come over and be with us tomorrow as well, but also making sure that there is continuity. And also with that same regard, we are very sorry, Charlene, you were not able to finish the fun part of your I drew mine here. And I was really ready to explain why I did this and that. However, with regards to what I've just announced or mentioned, allow me give an opportunity to young caregivers to provide a few minutes. Caitlin Holden to give a remark on her abstract, and then we can be able to close up, and then we close early, and then we can go on to the next, at least we prepare for tomorrow. Thank you very much. Caitlin.
I did, yeah.
Good afternoon, everyone. Thank you so much for allowing me the opportunity to come and speak at this conference. My name is Caitlin, and I am the Intake Coordinator and Community Engagement Facilitator for the Young Caregivers Association. So I'm here to talk to you about identifying young caregivers, mobilization, and then I will also talk a little bit about our organization at the end of my presentation. I'll get through it as quick as I can. It's not very long, I promise. I don't have my credentials yet. I'm a fourth year BSW student at McMaster, so I'm not as qualified as everyone else in the room. But so I want to start off by talking about who are young caregivers. So young caregivers are youths, children, and young adults between the ages of 5 and 25 who provide care for a family member through either personal, emotional, or financial support. This can look anything like caring for a sibling, parent, or a grandparent with chronic illness, disability, mental health concerns, substance misuse, socioeconomic factors such as multiple sibling homes, providing the family translation with language barriers like medical appointments and things like that, or in single parent homes where there's that little bit of a lack of responsibility on the single parent. So there's several different types of caregiving, and we look at them in 3 separate categories. We have our practical, our physical, personal, and our emotional forms of caregiving. So primarily we see emotional caregiving responsibilities falling into the younger demographic, so the children ages 5 to 12, because it's difficult for younger children to provide physical care roles. So instead they take on emotional responsibilities such as being that emotional support person, worrying about their family members, having to deal with meltdowns from siblings, and also carrying a lot of worries. So they try their best to cheer up their family members. And then we see moving into more of the practical and physical caregiving as they age into adulthood and take on more of that home care, medication administration, grooming needs, and filling in those extra holes. So in Canada, we estimate that there are approximately 1.25 million young caregivers across the country. However, this estimate does not include children under the age of 15, nor did this survey include the territories. So we do estimate there is a significantly larger number of caregivers. So let's talk about the impact of caregiving on these youths. So although caregivers play an important role in their families, they are often forced to grow up quickly, and many feel as though that they have missed out on their childhoods. This and added responsibilities in the home can lead to feelings of loneliness, sadness, anger, and frustration, and as well as these youth have deep feelings of isolation due to feeling different from friends and peers, which leads to suicide ideation and self-harm without intervention. As well, young caregivers provide a significant amount of care that equals to a part-time job, as well as effectively saving the government money on in-home care professionals, as well as live-in care facilities, with an annual savings of $25,000 to $50,000 per month per family on our healthcare system. We also see how age is a factor in these experiences, and younger caregivers experience higher levels of burden